Saturday, March 28, 2020. The second week of very strict isolation has passed, and we have to analyze again this week from a protocol and etiquette and soft diplomacy perspective. The first thing which came into my mind was a picture which appeared in my Twitter account from Her Excellency the President of Slovakia wearing a mask matching her costume during an official event. All her staff and all the participators were wearing gloves and masks. And this picture was very symptomatic because it shows that the etiquette already is highly impacted by the measurements that is required from all of us. Masks are, and this we have to analyze as well from a soft diplomacy perspective, something which from a soft diplomacy perspective creates a boundary between us and the others, because it covers parts of the face, which is then afterwards making it difficult to identify people. I'm not a medicine specialist, but the discussion how helpful masks are in specific areas is still ongoing. On the other hand, and this is a fact, we have to ask ourselves when we are wearing these types of masks, are we wearing these masks to protect ourselves for getting the disease? Or are we protecting the other ones when we are spreading the disease? And these are thoughts that I would like to invite everyone to consider, because it helps us a little bit to step as well in the perspective of the others. A second story that came to my attention was that during this week in a small town north of Lisbon in Portugal, a very reputable man, an elderly man, left his house in the early morning and fell on the street and had a heart attack. The sad thing is that the body was lying on the street for 11 hours because nobody had the courage to touch the body, because everybody was afraid it could be the coronavirus. And these are the consequences that are horrible, because at the end of the day, it was not the coronavirus. And we cannot blame the coronavirus for a behavior like this. We have to take the responsibility of not letting these kind of things happening to us. That we let a very reputable man lying on the street for 11 hours because we are afraid to get the disease. This is something which is making horrible consequences for the things which is the characteristics of us being humans. And this is something where we cannot blame the coronavirus. We can only blame ourselves for behaving like this. The positive things of the last week, which came to my attention as well, was an article I read from a futurist scientist whose name is Matthias Hawks. And he wrote an article on looking back to the period of the coronavirus, probably from September, October, November of this year to the period of the isolation we are all living in. Although the article is in German, I'm going to put the link in the description of this video, and probably with some translation programs you can get the quintessence of this article. Because it gives a very optimistic view towards the future and actually helps us at the moment as well to stay mentally healthy. Mentally healthy as well was one article that I received from an expert in cultural intelligence and former ISPD master graduate Heidi Dulleborn. She wrote an article of how during the corona crisis we could maintain our kindness. Being kind means as well to be respectful towards the other human beings. And this brings us back to the fact that when we are not being kind, when we are not having the approach of seeing other people's how they are, and we are seeing the opposite of us just as a threat, it has horrible consequences on the forthcoming of our interpersonal relationships. Seeing the other ones as a threat and seeing the other ones as a source of the virus is putting us in a position where we are going to isolate our minds even more than we are isolating already from a physical part of perspective. The isolation should be physical, but it should not be mentally. Mentally means that we should not take this period now to bring up more borders in our minds. We at ISPD have for more than 10 years tried to reduce the borders that are in our minds by reducing stereotypes and creating understanding for the other people and other cultures. Protocol, like Ines Pires always says, is not about ourselves, it's about the others. Soft diplomacy is based on the fact that we have to permanently have the trust towards our opposite, towards our counterparts. Trust, worthiness, reliability is something which is built up in a dialogue. The dialogue can only start and can only continue on a permanent level when we are having the confidence that the other one's opposite of us is trustworthy. This trustworthiness is at big risk today, because as soon as we see the other ones as a threat, we become full of fear. And the fear is bringing us to the perspective that we would like to isolate ourselves even more. And this is one of the negative consequences that we are living through at this moment. And I would not like to live in a world afterwards who has to cope with even more isolation mentally and physically when the crisis is over. Think as well about, when the crisis is over, how we took advantage of this part of life that we had to live in isolation. Again, think about mental healthiness in a way that how many social media am I consuming permanently? Why do I not have the time to read finally the books that I always wanted to read? Is it useful to just order junk food and sit in front of the television observing permanently what are the new numbers of victims? Is it fruitful to stay at home and eat junk food, become addicted to other things, and think about what is next going to happen and seeing the world blacker and blacker every day? These are some of the thoughts that we wanted to share with you, and I think it is important to maintain the dialogue, maintain mentally healthy, maintain our relationships in a way that we try to take advantage as well of the technical possibilities that are here today. We can make video calls very easily, we can work from home very easily, and many of the things are much more facilitated than it was in generations before. The generation of my grandparents had to live in much stronger crisis. After the World War, they had literally nothing. They did not have the possibility to make phone calls in that easy way, nor had they the possibility to stay at home, be safe, and get the treatment and the supply from the supermarkets that we are receiving all the time. Optimistic, looking to the future, staying mentally healthy, maintaining the dialogue, and being aware of which is the information that I'm sharing with others and which are the information that I would like to have when the crisis is coming to an end. Thank you very much.